start again in 3, 2, 1, go.
We are back at ECCMID and ECCMID TV, and drug resistance and bacterial resistance is a main topic, certainly, not only on this Congress here at ECCMID, but in every clinician's daily life. And my next guest is Professor George Daikos from the University of Athens.
Hi.
Nice to have you here. You just had a keynote lecture, and the hall, I've seen that, was packed with delegates on this subject, and you were talking about extensive drug-resistant gram-negative bacteria. Tell me a little bit more about what did you present?
Okay, as you mentioned, the MDR and XDR infections is a significant problem. It's a global problem, but some countries are affected more than others. And this probably happens, we face this problem when we have inadequate infection control practices and consumption of antibiotics without restrictions. So if you have both of these, then the problem is very prominent.
So this is the situation in Greece, isn't it?
Greece is one among the countries that has been affected the most by these pathogens. But as I mentioned, it's a global problem. It's not only unique for specific countries.
So what needs to be done to tackle this problem, especially, let's say, in those countries where the
As I
threat
mentioned,
is big?
mentioned, there are some very good examples, like Israel have controlled the spread of carbapenem-resistant Enterobacteriaceae. So if you have a strict infection control program in your area, in the whole nation, not only in one hospital, because
Right.
the patients communicate. One day come to one hospital, the other they go to the next hospital. Then you need to have a national program and in strict antibiotic policies, a stewardship program, as is mentioned, and then you are going to start seeing decreasing of these infections.
The antibiotic stewardship is in everybody's mouth, of course, not only on this Congress, but for years now. But in particular, what does it mean really on a very basic level and on a community level, so to speak?
Yeah, first of all, in the community you need to have restrictions, not buying antibiotics over the counter, but in the hospital you need to be very careful when you use antibiotics. If you use a broad spectrum of antibiotics at the beginning, then when you have the susceptibility back, then you can have de-escalation of this.
Right.
And go to specific according to the antibiogram.
If we don't do anything or just carry on doing as we do it now, where do you think, when we just do time travel, so to speak, in, let's say, 5 years, increase all over the world?
Yeah, there are some predictions, actually I mentioned in the talk, by O'Neill, that mentioned that in his analysis, if no action is taken, then by the year 2050, we are going to have 10 million extra deaths by these pathogens.
2050?
2050, and the cost will be up to 100 trillions per year. So amazing.
Yeah. So there needs some action to be taken.
Yes, of course.
So, and you addressed the countries already, like Greece, Italy, but Israel, you said, had a very good
Israel,
problem.
had the problem with CRE, carbapenem-resistant Enterobacteriaceae. Now I think they have problem with Acinetobacter, but in other countries also there are problems. Africa, Far East.
And I could imagine that developing countries will catch up in some years or in a short period of time, won't they?
In what terms, I mean?
I mean, the resistance to the drugs, multi-drug resistant Enterobacteriaceae.
Yeah, developing countries are affected.
Yeah. So not only Greece, it's not only the southern part of Europe, is it?
Yeah. No, African countries have problems In Far East, they have problems. In India, in China.
Yeah. And what treatment options are there left then?
Yeah. Unfortunately, our treatment options at this time are very limited, and the available drugs are not so effective. There is some green light. We have some new drugs. One was just recently approved in some European countries. It was approved in the US 2 years ago, and this is going to help in a portion of this bacteria, not in all of them. For Acinetobacter, for the time being, we don't have any programs. There are some drugs in development in phase 2 and phase 3 studies, and we are going to have in the near future. But we need to preserve those.
Absolutely, you're absolutely right. It was very nice talking to you, Professor Daikos. Thank you for taking your time and sharing your thoughts. Thank you very much. Enjoy ECCMID.
Thank you.